Okay, so what we're going to go over today is a component of the lower quarter functional examination. That's a LQFE that we use a little bit later in the course of treatment for pained individuals to look for dysfunctional movement patterns that we can address with specific correctives. So with this particular test I'm going to show you, our test sequence, we're really looking at flexion control. So what we want to do is position our patient flat. Ideally, we'll have our patients with their hands crossed above the chest so that the arms don't create a stable base, that would hide any of those dysfunctions. Now, for the sake of the camera, so we can get a good sense of what's going on here, I'm going to have her move her arms to the side just so that we can see what's going on. All right, so anytime we go through this sequence, we want to, know how far is their passive mobility of the joint system we're going to test. So in this case, it's going to be the hips. 2, what's their quality of motion when they just perform the movement actively. And 3, what's the quality of the motion when they create their VPAC. Now recall from previous videos that the VPAC is a volitional preemptive abdominal contraction, and that is a categorical term of different contraction strategies that we use to create the appropriate stiffness, active stiffness in the torso to create a good foundation off which the limbs move. And so for this particular subject, she has been coached on abdominal drawing in maneuver, and that's going to access her local system, or transverse abdominis, internal oblique, deep multifidus, right? And for any client, what we want to do is go through and establish their preferred contraction cue or word set. And so for her, when we palpate inside the ASIS and sink our thumbs into her internal oblique, representative of her transverse abdominis, i.e. her local system, we're going to ask her to build pressure under our thumbs to create that contraction. So go and contract and relax. And what I feel is a bit of tension building into my thumbs right here. What I don't want to see is pelvic tilting, sucking the abdominal wall up and into the spine. I don't want to see any flaring of the ribs, tilting up here. Okay? So as we go through this test sequence, what I'm going to do is just check her overall range. Now I'm just going to show you on this one side so you don't see my better half, but I'm going to find her ASIS and I'm going to monitor her pelvis with my left hand in this case. I'm going to grasp under her thigh. I'm going to say, young lady, thank you for being helpful, but I will move the limb, so please try to relax. And I'm just going to flex her hip to her in range. If I go higher, that's going to boss her spine into flexion in this case. So for her, as I'm here, I can move her hip into that much passive flexion. So that means she has to control that much passive flexion. So to right here, if we see movement dysfunction up here, past that limit, that's not movement dysfunction, that's just the end of the range. It necessitates motion upstairs. So we're not going to worry about that. We're looking for dysfunctions in the middle of the range that they have. Okay, so for the test, so we established the passive range of motion on both sides. Now, what we want to do is have her relax her torso. Everything's completely settled, and then we're going to be very specific in our word sets because we don't want to coach them up because that's going to be more the corrective strategies. So we're going to use very simple terminology. We want to use external targets to have them move in the correct direction. And so for her, I'm going to say, can you just lift this knee in a marching manner up to my hand? And we're going to see what happens. Down. So what we're looking for, we're going to look from this angle. We're going to see what's going on in the sagittal plane. We're going to look from this angle, see what's going on in the transverse plane. And then as we look down, we can see what's going on in the frontal plane. So even though this is a hip flexion test, we're really looking at 3 dimensions. And so for her, relax and perform that same movement up to there. Good. Now, what we're going to do is perform our VPAC strategy. We're going to build the pressure under my thumbs. Got it. Keep that pressure and then perform that same motion. And down. Keep it built. Good.